To this live tour of New York Medical College's Masters of Public Health program. Today is a great day to show you this program and give you a campus tour because most of our students are currently away on spring break and the campus is pretty quiet right now. So, my name is Stefan, as I told you before, and this is actually my third semester at New York Medical College as a Masters of Public Health student. My concentration is in health policy and management. Today, I'm going to give you a tour around the campus, show you many of the facilities that New York Medical College has to offer. I will also introduce you to a faculty advisor who will show you around the campus as well, and give you a tour and give you an example of what the student experience here at New York Medical College is like. It's been an awesome experience for me so far at New York Medical College, and I'm willing to share my experience with you and tell you about the admissions process at New York Medical College as well. You'll also get to meet a faculty member and advisor, as I told you before, who will answer any questions you have about the admissions process and tell you a lot about the school as well. So, my time at New York Medical College has been amazing so far, to say the least. It's been awesome. I've gotten many experiences here that I thought I would never get. The opportunity to come here was one that I could not pass on. My journey to public health started when I decided to volunteer in Ghana and work for an agency that worked in rural villages and go to rural villages and speak to children and provide health services to them. Before that, my only experience in healthcare was working with individuals. During that experience in Ghana, I had the opportunity to work with populations. Through that, I learned a lot about public health and became very interested in public health. After that, I wanted to come to a university which could provide me with the tools that I needed to succeed in the field of public health. I researched several schools. New York Medical College's program was amazing. The program is actually accredited by the C.E.P.H, the Council of Education on Public Health. New York Medical College's program was one that I could not pass on. I found out many things about the school, such as the wonderful faculty here and the curriculum. The curriculum provides me with an array of classes that can develop my skills as a professional in the public health field. It's been great so far. I've gotten the chance to network and meet with many individuals. My classmates have been amazing. So far, I've gotten the opportunity to meet people from all over the world. Some of my classmates are from different countries, such as Ghana, Saudi Arabia, Dubai, Nigeria, India, everywhere. It's been a wonderful journey so far. I'm going to show you a little bit about the location of New York Medical College and where it's located. So, New York Medical College is located in Westchester County, New York. We're actually 30 miles away from New York City. One of the reasons why I decided to come here was because of the location of New York Medical College. It's like I'm not living in New York City, but it's so close to New York City that you can go whenever you like. So let me show you a couple places at New York Medical College. We actually just left the School of Health Sciences and Practice, where I introduced myself to you earlier. So not far from New York Medical College is the Westchester Medical Center. It is a level 1 trauma center in New York, and it's one of the area's largest trauma centers completely. Also, we have Maria Ferrari's Children's Hospital. This is actually a pediatric hospital close to campus. It's not far at all. And we also have the Westchester Institute of Human Development. a lot of students actually are employed at this Institute of Human Development. And we also have Skyline. It's the home, Skyline Drive is the home to the newest dental school in New York. And it's not far from the school at all. So New York is great. We have everything here. We also have the nightlife is amazing. We have hiking in Westchester. There's access to many parks, and it's amazing. White Plains is very close to New York as well. So I'm going to tell you about the school and its storied background. New York Medical College has had a mission to deliver services to the poor and assist the powerless. And I've had the opportunity to witness this through the opportunities that New York Medical College offers. We've actually graduated the first Canadian physician ever. She wasn't able to get admissions to the medical schools in Canada and was granted admission to New York Medical College and graduated from here. Also, New York Medical College graduated the third African American woman to complete medical school. She was the first African American woman to complete medical school in New York, in the state of New York. So we've graduated a Canadian woman who was a physician, the first female physician, and the first African American woman in the state of New York. There's many opportunities at New York Medical College. The school is amazing. I'm going to tell you a little bit about the library, which we're actually right in front of. Right? Different types of dishes every day of the week that they provide for us. It's amazing. I wish that I can actually go and eat right now. That's how good the food is. Yeah. So I'm going to actually show you the bookstore as well. The bookstore has access to all the different materials that you need, your textbooks for your classes. It has access to t-shirts that have our logo on them. We have access to folders. The staff is pretty amazing. How are you?
Good. What are you doing here?
Yeah, we're actually filming a live tour of our Facebook of our campus. We had different types of health professionals come to our school and mentor our students and provide them with the information and knowledge they need in order to become successful in public health. We've also done resume workshops and writing workshops to help us improve our resumes so that after we graduate, we're able to apply to jobs and get great jobs. We've also done a walk for breast cancer, and we recently just had a celebrated National Public Health Week where we performed many activities and did several programs within the community to promote public health for the underserved. It's been amazing at New York Medical College. The opportunities are endless. You will meet many students, have the opportunity to network here. You will have the opportunity to advance and gain knowledge as a professional and advance whatever you need in the field of public health to promote you to where you want to be. We offer different types of programs here, from health policy and management to epidemiology to anything you need in the field of public health. I'm actually going to introduce you to one of our alumni. Her name is Karen Emerith, and she actually graduated in 2010. She's going to take charge of the tour and show you New York Medical College. Thank you, Karen.
Thank you so much, Stefan. I'm sure everyone has been enjoying the tour with you so far. Yeah, so I'm Carol Amaranth, and I graduated in 2010 with a degree in public health in maternal and child health. And I first decided to come to New York Medical College. I was working at the time at a child advocacy center in the Bronx, and a master's degree in fine arts and art therapy, which had brought me somewhat on a journey from the arts into healthcare. And it just seemed like a very natural progression for me to come here to pursue a degree in public health. I must say that when I first stepped over the threshold into my first class in 2005, I knew it was going to be a pretty long journey because I was working full time, I had family, and I knew that it was going to be one class a semester, 3 semesters a year, and it was going to take me a while. But I could not have imagined, actually, when I took that first step, how much I would enjoy the classes, how much they would enhance my own life and my personal mission, and also how much the classes I was taking would really interface and enhance my work at the time. So let's see, we're moving along here, and I want to just, as we're walking along, point out some places. We're going to be approaching Sunshine Cottage, which opened in the early 1930s as a hospital for children with tuberculosis. The hospital, as you'll see, it's a very lovely building, was decorated and designed in a way that children would feel very comfortable. They would feel like they were in a very lovely place, not only to be cured of the tuberculosis, but to have a sense of health and well-being. So we are almost there. And while we're on our way, I'll just continue with my journey at New York Medical College, which then brought me to taking classes in statistics and global health, which then set me on a course of writing my master's thesis and doing research around global maternal child health and the reduction of maternal and infant mortality, particularly in rural areas of developing countries. So here we are at Sunshine Cottage. And again, this was a hospital for children and now is our administration building. It retains its loveliness, and in addition to the beautiful decorations in the building, there are some of the animals are out on the back lawn. So I just also want to point out how lovely this campus is. It's a beautiful day today here near Sunshine Cottage, a lovely sunshiny day. You can see we have lovely lawns, trees. We're in a very beautiful area of Westchester County. But again, as Stefan had noted, you can get on a train in White Plains and be in Manhattan in about a half an hour. So our location is wonderful. You can also go a little bit north of here and go hiking in Fonsstock, go sailing on the Hudson River. It's a wonderful place to be when you're not in your classes learning. So again, we're moving along here from Sunshine Cottage. I wanted to talk a little bit about the alumni experience. So New York Medical College is very committed to keeping us all in touch and linked in together. There have been several opportunities. There's mentoring opportunities. There is an alumni advisory board that I belong to. And I had a great experience last year as an alum to provide a presentation for faculty and students. So just to back up a little bit, while I was writing my master's thesis, I was in touch with the founder of the Birthing Kit Foundation in Australia. She and I were emailing about various issues around global maternal mortality, how she developed the Birthing Kit and the Birthing Kit Foundation. We became friends, and after about 5 years of sending emails and being in touch with each other, we were able to meet. We were both going to the Women Deliver conference in Copenhagen, and she flew here to New York on her way to Copenhagen. We spent a few days hiking and going to the theater in New York, and then she and I provided a presentation for faculty and students on the efficacy of birthing kits and the project that I had co-founded with the Rotary in Kampala, Uganda, where we're distributing birthing kits in the rural areas of Uganda. So that was a great experience. In fact, last week during Public Health Week, we had an alumni gathering, And I met a young woman there who's a medical student. And when I introduced myself, she said, "Oh, yes, I was able to attend your presentation with Dr. O'Hazy last year." So we keep in touch, we support each other. There are great opportunities to use your public health degree to, while you're here taking classes, to interface what you're learning with the work that you're doing if you are working full-time, as well as being here in classes. And just the way everything that you learn here can support and interface with the things that you're doing, and also open up opportunities that you might not even have thought of. When I first started here, it never occurred to me that in a program planning and evaluation class with Dr. Liberatos, I would read an article in the Lancet about a very successful project in rural Nepal, and that I would in fact use that research from that project to grow my research and my master's thesis. But also, I went to Nepal and I visited the Mira project. So just as a little sidebar to that, for any of you who are watching, whether you're in public health or some other field, if you're doing research, you're reading articles of interest to you, never hesitate to try to be in touch with the authors. They love to hear from people who have read their articles, and it's a great experience for you to get to know people. Through the research that I did here at New York Medical College, and with a lot of support from my professors and instructors and colleagues here at New York Medical College, I met so many wonderful people internationally that have really enhanced my life and enhanced the work that I do. So I'm currently the Director of Victims Assistance Services in Westchester County. We provide very comprehensive services to victims of all crime. And while we clearly interface and work very closely with the criminal justice system, with law enforcement, we also have been able to, and I think that my influence in public health has had a lot to do with this, we also are addressing public health, addressing victimization from a public health perspective. We have advocates that go into the hospital to support victims of sexual assault. We provide therapy, we provide counseling services so that victims, survivors of crime, also have a very holistic experience that hopefully then supports their general health and well-being. So let's see, we're approaching now the School of Health Sciences and Practice, where you are going to meet Dr. Denise Tahara, and she's going to tell you more about the programs here. And again, if you just look around at how lovely the surroundings are on this very beautiful sunshiny day. And let's just take one minute here. Make sure that you have your sunscreen on. There, up a little bit there on your nose. Good. Here we are, entering the building. And again, this is where I first stepped in to start my 5 years of school here, which was, I just want to tell you, a really amazing experience. So step through the doorway with me, and here we are. This is the Center for Interactive Learning. It's a really beautiful space, and this is where I had my very first class. So, Dr. Denise Tahara.
Thank you very much.
Thank
Hi.
you.
Welcome to the Center for Interactive Learning, which is in the School of Health Science and Practice. And as Carol mentioned, this is where a lot of our core courses take place, as well as classes with, we have a lot of guest lectures. It's a really great space. I personally like it. The students feel very professional. As you can see on the tables here, we set up microphones so that they can ask questions to the presenter. We also have some really terrific technology. So you've had a chance to walk around the campus with both Stefan and Carol, and I'm going to tell you a little bit about the program and why particularly I came here and why I think it's just a great place for our students. The first, as you saw from our beautiful campus, is the location. I like being able to walk from my car. I like being able to breathe the fresh air and see this open space. It's good for the soul and it's good for the mind. And the other thing about it is actually the location of the school itself. Our campus is sort of nestled in the Hudson Valley, which is 45 minutes from New York City. It's also in an interesting place because it's right at sort of the intersection of 3 states. So we have Connecticut, New Jersey, and New York, and also 3 completely different kinds of communities. So we have urban, rural, and suburban, all really within a very, maybe 15-mile radius. The reason that that's important is it creates wonderful opportunities for our students in terms of being able to work on population-based health issues or public health issues. We work with a lot of community providers, a lot of community-based organizations on a variety of kinds of projects, and it means lots of types of opportunities for our students, and in a variety of settings and in a variety of ways. One of the ways that our students get that experience first way is usually through what we call a practicum, which is a required public health experience. And as I said, with a variety of options and a variety of kinds of organizations, you can find your own place. The second is through our capstone process, which all of our programs have a culminating experience, which are applied research practice experiences. That means we partner with community-based organizations in New York City. We have some in Long Island. We have some up in the Hudson Valley region, and sometimes even in Connecticut. And these are opportunities for students to really work with community-based organizations on their problems and their challenges and come up with solutions. It could be developing a program. It could be helping them to target a particular population. It could be evaluating a program that they have in place. So there are a lot of ways that that can happen. For our doctoral students, it also means internships, and that is a requirement for the doctoral, the D.R.Ph. degree. And finally, we've developed some very nice partnerships and relationships with the community organizations. And for our students who are graduating, either who are interested in changing jobs or are interested in trying something new, or for our students who are looking for new employment opportunities, there's a host of opportunities around here. A lot of the providers contact us directly and say, I have a position open. Would you have a student who might be interested in this? So those, I would say, were the reasons from a location perspective that I chose to come to this school. I actually came here before we started our distance learning program, which is now, so if you don't come to the campus, you don't get to see this beautiful space. However, you do still have the interaction with the same faculty. So the same faculty teach in both the on-campus and in the distance program. And which then leads me to my other reason why I like this program here. It's a small program, which means tremendous opportunity to interact with faculty. The classes are not strictly didactic, lots of facilitated conversation or discussion. We like to hear from the students. And that's both for the on-campus and online classes as well.
I'm Pam Sood, and I'm the Director of Recruitment here at New York Medical College. And I'm going to talk to you a little bit about the admissions and programs here at the college. If you email or you call or you attend a web chat, I will be speaking to you personally. I answer the phone, I answer questions, I help you, I counsel you, I mentor you, and I can do everything I can to make you a successful student in our program.